Nearly 25 million people in the U.S. are allergic to penicillin, and thanks to a new trial, many patients may soon find out they are no longer considered allergic to the key antibiotic. We're joined this morning by Dr. Reena Mehta with Uptown Allergy and Asthma to tell us what this trial could mean for millions of people across the country. Good morning. Thank you for being with us.
Good morning. Thank you so much for having me.
So explain to us what this study or how the study worked exactly and what the researchers found.
Okay, so great question. So let me first give you some statistics.
Okay.
So 25 million Americans think that they are allergic to penicillin.
And you said think.
Think.
That's a key word.
Exactly. 90% of those patients or people are not actually allergic. So it's kind of mind-blowing that you can say that 1 out of 10 people think they're allergic to penicillin and they may not even be.
Wow. I mean, that is staggering. And because of that, people take all kind of alternative medications if they have some type of infection, right?
Exactly. So sometimes this label comes from, okay, when I was 3 years old, I had a rash and it might not have even been related to the medication. Or my mom said I was allergic to penicillin, or I have a family history of penicillin allergy. But the truth is 90% of those people are not allergic. And out of the 10% of people who truly are allergic to penicillin, most of them, 80% of it will outgrow it within a span of 7 to 10 years.
So when people are taking these alternatives to penicillin, what can that do to your body? These people, 25 million who think that they are allergic and they're taking alternatives, what other issues could they have been creating in their bodies?
Antibiotic resistance, gut issues. A lot of these second generation or second alternative antibiotics have a lot of side effects. It can create a lot of problems where they're more expensive. And it may not be the most effective way to treat the infection. And so really what this study showed in JAMA was that they looked at people who had this remote history of penicillin allergy, so people who probably didn't. And what they said was, okay, you can go to an allergist and get skin testing, or you can just go ahead and take a direct challenge of the medication where you orally ingest it under the supervision of a physician and see what happens. And what they found was that the majority of patients who just went to direct challenge, which means under the supervision of a physician, but actually just had the penicillin in a monitored setting, did absolutely fine.
So Dr. Mehta, you're saying for people out there who have long thought, or as you mentioned, by their parents, been told that they have a penicillin allergy, they can come to your office and you will give them a penicillin orally?
That's exactly what it is.
And then just watch it. And how does that process work? You kind of said it, but kind of explain that process.
So if I am concerned about penicillin allergy, I will perform allergy skin testing. So that's a skin prick testing. And if it's negative, then I would proceed with the oral challenge.
Okay.
But if you have this very remote history of probably don't have the allergy anymore, what I would do is I would have you bring in oral penicillin, so amoxicillin. I would give you 10% of the dose, watch you for 30 minutes, and then if you have no reaction, I would give you the remainder 90% of the dose and watch you for an hour. If nothing happens, you are not allergic and you can take it off of your allergy list.
What kind of game changer is this for millions of people across the country and so many people right here in our area?
So the whole point of this is to raise awareness that if you think you're allergic, you're probably not. And so it's really important to go talk to your doctor about it, because if you can delabel this allergy, if you can actually take penicillin, amoxicillin, all these medications related to this family, you can save a lot of healthcare dollars, a lot of side effects, and probably treat the infections better than what you've been doing all along.
That is incredible. And so basically the moral of this conversation is, if you're allergic to penicillin, call your doctor.
Yeah, you're probably not.
You're probably not. Time to have a conversation with your doctor and maybe some other steps.
Exactly.
Dr. Mehta, thank you so much. That's so interesting. We appreciate you being here this morning explaining that.
Thank you so much for having me.